This is the flow sheet. It will be very helpful in helping you to deliver the best care to each patient, as well as to support providers in delivering that care. It orients you to some of the basics about the patient, such as their name. It will always be listed last name first and then first name after that. And sometimes, if a patient goes by a different name, you'll see up above in quotations here their preferred name. For example, if the given name was Richard written here and the patient goes by Rich, you'll see up here in quotations written the name Rich. Below is their diagnosis. This tells you the main concern the patient's coming in for. It could tell you the location of their pain. It could tell you that they're coming in for dizziness or for weakness or for balance issues or for challenges with their pelvic floor. This will give you a sense as to what type of patient is coming in. And the MD refers to the provider who referred the patient to our facility. When a patient comes in, this will be the first thing that you grab to orient yourself to the patient's setup. This will help you know how to get them started within the clinic. You'll direct your attention to this part of the flow sheet. You'll notice that at the very top, it indicates whether that patient might be an exercise only, in which case, when they first show up, you'll go ahead and get them started with permission from the provider. Or if they're exercise first, you will get them started with exercise with permission from the provider. However, if neither of those are circled, you can jump your eyes down to these parts right here where it indicates what position the patient will be set in. These are those positional terms we were talking about earlier, and whether or not their legs will be propped on a bolster. This will also indicate right here if they have any sort of electrical stimulation setup. We tend to do a lot of IFC setup, and we'll talk about that in a future video. And then below that, you'll see their heat setup. There's different types of heat packs. There's cervical heat packs, lumbar heat packs, medium heat packs. We can even indicate other things as if they might need an extra towel because they get too hot on the heat setup with our regular setup. This is what you'll look at to know exactly how to start a patient, what position to have them in, whether it's heat and TENS unit setup or maybe just heat, and how to have their legs propped and if they need any extra accommodations. This will help you feel that you're doing your role well. If you direct your attention over here to the left-hand side, you'll notice diagrams of the human body. On here, when we fill these out as providers, you might see a square or a rectangle shape that is indicating where we would place the heat pack selected over here. You might also see X's indicating which spots we would want each of the 4 pads that go with the electrical stimulation setup to be placed. We will go over these setups in future videos in greater detail. Once you set up a patient, you'll start a timer as we've talked about in other videos. And once that timer goes off, it is then your role to get the patient set up for the providers as we've discussed. You'll know how to do that by directing yourself to this section down here with soft tissue as the top heading. It will have other setups for which positions that the provider would like them to be in. Whichever one is circled, you can feel confident to take the patient from their heat setup straight to the new position. For example, if a patient came in for low back pain and they were supine, laying on their back with their legs propped by a bolster, and they had a lumbar heat pack on their back with an IFC setup crisscross here at the lower back, when they are ready to go and the provider indicates that they are ready to take their patient, you will take the heat off of them and the TENS unit pads off of them, and then you will look down below to see what position to have them in. A common position is a seated position where the patient is seated on a stool next to the table with their arms propped at the table. If you see that circled, you'll know that that's how you can set them up and have them ready to go so that the provider can come right in and get to work. This will also help you understand, as you see these different techniques circled, what other interventions that we perform with the patients. You'll become familiar with these over time, but the most important thing is that you understand that when a provider is done, they might say something to the effect of, All right, let's see what you got next, which indicates that it's your job to turn over the flow sheet. What you'll find on the other side looks like this. As we've indicated, you'll find the patient's name here, just like on the back side, and the year in which these dates and visits are taking place. At the top, you'll see that the date of each session will be noted. This is a responsibility that you have as our exercise specialists to make sure that you are filling out this flow sheet with accuracy. It's important to understand that this isn't just a guide for you. This is a medical document that we scan in as part of the patient's medical chart. It's important that it is accurate, and please do your best to make sure that you're filling it out to your best ability. Once the date's filled out, you'll also indicate down here who set the patient up pre-visit. You'll see the letters pre here. We would also see it match the backside for that patient example that we had before. You'd see MHP circled for moist heat pack, and you'd see the IFC circled because they both had those happen. So if I were filling this out and I had set the patient up on their heat and their IFC setup, I would write my initials JB right here, and I'd write a small little IM in the top right corner to indicate that I did both the heat setup and the TENS unit setup that day, as there might be days where we elect not to do one or the other, and we want to make sure it's clear what we did that day. After that's filled out, when you set a patient up, again, we indicated that you'll get them maneuvered to the next position. And then when the provider says that they're ready to start their exercises, you'll flip it over to this side and see the exercise names over here in this column. We will orient you to what these will be in the future and how to train on those exercises. But this is where you're going to start looking through the exercises. In this slim column here, you'll see that our providers write in different initials that stand for different places that the patient will be performing exercise. For example, if you see the letter T, it means table. If you see the letter C, it means chair. If you see the letter W, it means wall. If you see two slashes that are parallel to each other, that means they're performing them in the bars. Now, if you don't know what these things mean yet, that's okay. We'll cover these in future videos too. These numbers are important for providers to circle. You don't need to know necessarily what they mean, but they just represent different billing codes for what we're focusing on with each exercise. This is mostly meant for our providers. However, when we run out of space at this 12th visit here, what we'll do is we'll grab another sheet out. One of your jobs will be to help on that second sheet to transcribe over for each of the exercises that we're keeping, just transcribe over the proper numbers and codes for each of those exercises on the next page. You'll also see here indicated in this column whether something's performed only on the right side, only on the left side, or on both sides. This stands for bilateral. If you have any questions, please let us know. Then in this top box, we have a level of resistance. This could be measured by a number of pounds. This could be measured by the color of resistance band that we use. This could be measured by a number of things. As you get familiar with exercises, we will orient you to what each of these things mean. And then the sets and repetitions performed. How many times a patient might perform this exercise or for how long. This will be indicated in the corresponding boxes. So for this date, if a patient was doing a bicycle exercise, you'll see that written here. And then you'll see at what resistance level on the bike, maybe level 4, so you might see like something like L4, and maybe 6 minutes. So you'll have 6 and then a little dash with the minute sign here. The way that we use this sheet is once we complete an exercise, we record it here. That helps us to have nonverbal communication with our other exercise specialists and providers who will also be referring to this chart to help patients throughout their visit. As we discussed earlier, with this patient that might already be at the table getting treated, we might turn our focus to the exercises that have T next to them in this column to start with all of the table exercises first so that we stay efficient. And then hopping to things like the bike, which we tend to put toward the top of the patient's chart. This will prevent bottlenecking and keep our flow in a good place. Now you may notice that each visit that the patient is performing the same number of repetitions and the same level of resistance. This is not our design to have this happen throughout a whole patient's program. In fact, if you notice that 3 or 4 visits in that a patient's exercise hasn't progressed or changed in any way, you may suggest to us, hey, will you take a look at this? We need to update this patient's program. That'll help us deliver the best care to that patient, and it will also help us satisfy the needs of insurance. Down here at the bottom, these portions are mostly used by the providers. These are all the hands-on therapy treatments that we can do, and it's the provider's responsibility to be able to notate what they did that day. What they'll do is if they worked on that patient that day, they'll write their initials here, and then they will just place check marks down here with little initials for which of these that they did. For example, if they used STM and the hypersphere, they would write JB up here, do a check mark, and then a small little SH up here for what was indicated. Again, this is a little less important for you to know the details of, and more important that you know that you can help us as providers stay accountable by filling out this portion. If you notice any blank spaces here, take ownership over the program and suggest to the provider to make sure that they're filling out their portion of this flow sheet. Again, this is a medical document and it's important that we have it filled out correctly. At the end of a patient's visit, we might need to set them up on ice, and we can flip to the backside to see what type of ice that we use. Typically, we use an oversized or cervical pack. Ice massage is typically performed by our providers if necessary. So again, we'll see here what type of ice pack to be used, and then again, we'll refer to this side of the chart to see where to place that ice pack in what position. You'll see here whether that's indicated for them to be able to use that post-treatment, and they'll have the indicated treatment here. Sometimes we even use heat at the end, so you might see moist heat pack at the end and at the beginning. If you have any questions on anything, please coordinate with the provider that's working with the patient that day. A few other things that make this flow sheet invaluable to everybody who uses it are some of the indications that we have here. You'll see that we can use these to circle different challenges that the patient might have that can impact their care. For example, if they have poor balance and they're likely to fall, we'll see the balance circled. They might have visual impairments that are important to know. They might have deficits in memory as well. They may not have an ability to hear, or they might have an implant, such as a pacemaker, which would prevent them from having electrical stimulation treatments such as these. Whatever is circled on here, please make sure that you work to understand what that means and how that might impact their care that day. As you work with us, you'll get to learn more on what that means. What really sets us apart and what I love the most are these two sections down here. Patient's hope is determined from the first visit with the physical therapist that they see. We ask a question where we say, I want you to picture the end of physical therapy when we're discharging you. We want that to be an exciting day and to have you look back at our time together and have you feel absolutely thrilled with your experience. What are the things you hope to be able to do at the end of care that will make this absolutely thrilling for you? This is where patients' eyes light up and where we become a part of their world. This is where we get to learn about their desires to play with their grandkids, or to travel, or to play golf, or to knit, or 100 other things that they want to be able to perform that their diagnosis over here is keeping them from doing at this point. This is where we often celebrate wins together. This is often where I get goosebumps when I hear how well patients are doing with specific goals that I know are important to them. Take time to review this when you pick up a patient's chart so that you can feel connected to what's important to them and know what they're working toward. We also fill out this portion called notes. This will have a wide range of information here, some of it geared toward providers to know certain details of their diagnosis, whether it's a surgery date or a result on an MRI. But there will also be things written on here that indicate whether this person was a former patient, or maybe they're a retired nurse, or maybe they really have an interest in music. Maybe there's somebody who is likely to push it too hard and try to do more repetitions than we prescribe. Anything that you need to know about the patient will be here, and this is a really quick snapshot and a cheat sheet for anybody that's going to be working with that patient to know what to expect. So please take time to review that as well before working with the patient. Last but not least, you'll also see here on this side that if we have anything important, we'll write it at the top here